introduce you to HealthSnap Senior Director of Patient Outreach Services, Monica Dubroja.
Hi, everyone. Thank you, Sunny, for that great introduction. So welcome. I'm going to do a brief overview of really looking at how to optimize our patient engagement. As Sunny stated, my name is Monica Dubroja, and I am the Senior Director of Outreach, and I oversee the HealthSnap Angel team. And yes, you are seeing that right. We have a team of angels, and our role and our responsibility is to oversee the patients in remote patient monitoring. So I think it's important to define and really just be reminded about what remote patient monitoring is as we dive into this a little bit. And just given where we are today with telemedicine and telehealth, understanding that RPM is a technology that really allows the healthcare providers to monitor their patients outside of the clinical setting. So when we think about this, we think about the nice extension of care that's happening now. Patients can be monitored at home. They can feel comfortable knowing they're at home. Also, when we think about these remote locations, isolated little towns where a doctor is not accessible, remote patient monitoring is ideal. And when we look at this, we really look at that it's a secure electronic transmission of these data points, and it helps manage chronic conditions and really improves the patient outcome. RPM is just an important component and extension of our doctor's offices and the healthcare system, because it really increases access to care for our patients and decreases their healthcare costs. And we are in a world that is moving rapidly and technology is at the forefront. So we really have to look at how we can really keep these patients engaged and to keep them healthy using these platforms and new systems in place. So the webinar is about optimizing patient care. So we really have to look at what patient engagement means. Now, patient engagement means a lot of different things to a lot of different people. But when we look at it, we really have to understand that it's the collaboration of the provider and the patient working together to improve health outcomes. A really important concept of great patient engagement is a patient has to be an active participant in the decision-making processes affecting their own health. We really have to look at pulling that intrinsic desire to improve health outcomes. Ideal patient engagement comes when you have that patient that's ready and really interested in making a dent and making some movement in the needle for better healthcare outcomes. I also, when I was looking up information on patient engagement, I was like, you know what do providers, what are the different definitions of patient engagement? And a couple of things that I added on here, one provider states patient engagement is about just patients answering, calling the office or answering the phone calls, making and honestly keeping their appointments. That this provider, that is a patient being engaged. To another provider, it's making healthy lifestyle changes, compliance with their medications, advanced directives, and priority and value of their health care and their health outcomes. Another provider saying, you know what, a patient really needs to be considered as part of the care team, able to be a self-advocate for their own care. So as we can see, patient engagement is all-encompassing. It's not, it has many different definitions, and it means a lot of different things to a lot of different people. So keeping this in mind, when we look at remote patient monitoring and patient engagement, we really have to look at how do we marry the two of these? How do we marry these for optimal outcomes? So as Sunny had stated, some best practices that we've seen are really important to have optimal outcomes. So number one, we have identified that there needs to be a team in a physician office that's really dedicated to the success of the program. This office has embraced an RPM program. They need to, in what that means is they really have to embrace it in terms of the value to the patient. This is a great extension of the doctor and the care that we are offering to the patient. They have to be able to communicate that with that patient in a manner that helps the patient understand it. And as a team, they're all working for the ultimate goal, which is to have better healthcare outcomes and to really understand what a patient needs and providing them with a service that is valuable to them for their health and well-being. We also have identified that conversations need to be led by the physician. with the patients on prescribing the remote patient monitoring for their disease prevention and their disease management. It's critical that a provider-initiated conversation happens. A patient trusts the doctor, the provider that they're seeing. So any conversations that come from that doctor that affect a patient's health are very valuable to a patient. So this is really important, and we're going to touch about that upon that on the next slide. It's also important to identify the ideal patient. Is there an ideal patient? We want to say all patients are ideal for remote patient monitoring, but we really have to look at the medical necessity and the patient demographic, and what this means to be successful in a remote patient monitoring program. And lastly, we really have to look at the physician or the office, the engagement that they have with the patient during their RPM time and when they've been prescribed this program, and to encourage some proactive health behavior, encouraging communication about their proactive health behaviors. And we really want to prevent floundering in RPM land, and I'll talk about that more shortly. So what's very important to identify is that when prescribing an RPM program, that this is driven by the provider. This is part of their plan of care. And when there's conversations that are happening in the office, there's some key points that have to be addressed. First of all, it's very important to keep the information very simple when describing the RPM program to a patient, and helping them understand what it entails. And this way, the patient has an understanding of this. Hi, Sally, I want to prescribe you for our remote patient monitoring program. What this means is you're going to be taking your blood sugars or your blood pressure daily so we can monitor your diabetes. You're going to be contacted by a vendor who's going to connect you and set you up to get your data, physiological data points transmitted over to the office where I can take a look at it daily. So information is simple so they can understand it. It is so helpful because, again, people are fearful of the unknown. So the more that they know about a program, the more comfortable they are, the better the outcome. Also being as specific as possible of the steps involved. So when a patient leaves the office, they have to have an understanding of the next steps that are going to happen if the patient has been prescribed RPM program. The next step is when you get home, you're going to be outreached by somebody, and they're going to talk to you about the program again and get you set up so that we can get that data transmitted over to me. And these are the reasons why this is really important. We also have to understand that it's important to get the patients involved in setting their goals. Just as we saw on the earlier slide, patient engagement, pulling that intrinsic value, intrinsic desire within a patient to move the needle a little bit. So if you have a patient that's a diabetic, as a provider, you know the goal that you would like to see. But as a patient, what would be their goal? And a lot of the times in working with this population, a goal is, you know what? I just don't take my glucose daily. I just don't like it. It's painful or it's uncomfortable. So their goal might just be taking a glucose reading daily and having that transmitted. So really having conversations with their patient regarding the RPM program you're prescribing and what a suitable goal is for the both of you. And this is where ensuring everyone's on the same page. If you're setting goals for the patient that you prescribe the program for, let's make sure that everyone understands it, understand what it entails, the duration of the program for the patient. Also, really important to create some accountability with that patient. What it shows is care and trust and follow-up. As you can see on the right-hand side, there's a prescription demo of it. And this patient's been prescribed remote patient monitoring for hypertension and obesity for 6 months. So to create accountability on this prescription would be to set an appointment at the 3 or 6 month mark for follow-up. At that point, you can do whether it's an in-office visit or a virtual visit, to review their data transmissions, to review how they're doing, and create some accountability over the prescription, as this is a program for them to be engaged in. Also, to ensure engagement, it's important to perhaps message and provide feedback to that patient during their time in a program so that they feel that they are truly in a partnership with the physician's office. So it's, as the slide states, the conversations really need to be driven by the provider's office, for what this program entails to really have a great outcome with patient engagement. Because again, remember, they trust and value the primary care providers that they do see. How do we identify the candidate that's ideal? This is a very interesting topic. So what we have learned, best practices, of course, we'd like everyone to put up their hand and pick me, I'll do it. But we have to really look at the data. So patients that are managing the chronic condition, hypertension, diabetes, obesity, are great candidates. Because again, a lot of patients are already manually entering data for hypertension, for their blood pressure numbers on paper. I actually just had a conversation with my father the other day. He's writing his numbers down on a piece of paper and he's calling them in to his doctor daily. What a great candidate for remote patient monitoring. Also with, you know, diabetes, obesity, these are just good patients to be managed. Weight management is hard. Weight management is challenging. So accountability has been proven to go a long way for keeping patients compliant and more in tune with their weight. Thus, our RPM program is a really good program for them as well. We can look at patients that have demonstrated active participation in their health. Those patients that do routine visits, that are going in for their annual physicals and screenings. Those patients that really care about their lab values when they go to the doctor and say, you know what, doctor, what was my cholesterol? What was my blood sugar? What was my A1C last time? Those patients are good patients for a RPM program because they want to change their health outcomes and they're interested. Also, again, this relationship with the provider and the provider's office. These strong, trusting relationships will go very far in identifying ideal candidates. Everybody knows those patients that you have these strong relationships with, and all it takes is a phone call to say, you know what, John, I really would like you to do this remote patient monitoring program for your blood pressure, and this is why. Every time you come into the office, you've had white coat, your blood pressure is high, and I know you're doing a good job taking care of it. I just think that you would benefit from being on this program for a couple of months so we can just make sure. This is prevention. Patients that are relatively tech savvy. So when we are dealing with a remote monitoring program, there's a bit of technology involved, and we just have to acknowledge that and understand that patients have to have the ability or the knowledge to navigate through their phone, perhaps, to find an app in an app store, or have the ability to work off an iPad or a computer. These are ideal candidates. Again, this is a technology-based platform for many people. Patients that may be overutilizers or frequent flyers of the health system or the doctor's office. So when I talk about being a frequent flyer, a lot of times we see patients, there are patients that may call the office 3 to 4 days a week, 1 to 2 days a week, because they're scared. Their numbers are climbing, their blood pressure is going high, their blood sugar is going high. They want to communicate this to the physician. So these are good candidates for remote patient monitoring. It's going to alleviate that anxiety for them, knowing that their data is getting transmitted and their doctor or the medical assistant or the nurse is going to have access to it daily. These are good people to be put on an RPM program. Also, the overutilizers, the ones that go to the ER all the time, perhaps because of certain things. Again, these may be really good candidates. It's important to take in consideration social history and to look at that. Patients living alone, especially during this time with COVID. There's a lot of people right now isolated and alone, not comfortable going out to the doctor's offices and getting an extension of their care. These are great candidates to prescribe into a remote patient monitoring program. Floundering in RPM land. So it's a very interesting topic. So we get patients involved. We get them enrolled in our remote patient monitoring program. The doctor's prescribed it, everything is going well, and then they've been connected and they're transmitting data. But what happens next? The question from the patient, now what do I do? I'm just hanging out here transmitting data. Where do I go? So what we really want to understand and we want to prevent is floundering in RPM land. We don't want patients to flounder, we want them to thrive. So how do we get them to thrive? It's critical that the office has engagement with a patient during their RPM prescription time. So if a patient's been prescribed for 3 months on a remote patient monitoring program to monitor their blood pressure, it'd be great if a monthly message even happened to acknowledge engagement and compliance. Over to the right, you just see a messaging component that we use in our platform, HealthSnap, and all it does is, a little conversation goes a long way. The patient feels connected to the provider, the office is taking care of her. She thus is more likely to stay engaged and compliant with this new behavior. So we really have to look at that when looking at prescribing RPM programs. It's also important to really set a goal for a remote patient monitoring program. This could be a daily glucose reading, as I mentioned earlier. How about lowering of blood pressure by a certain amount of points? Reduction of weight by 5%. What is the outcome that wants to be achieved with that prescription of remote patient monitoring? I'm prescribing Sally for a remote patient monitoring program for obesity and monitoring her weight. The ideal goal is a weight reduction of 5%. So let's set a goal. Thus, we get follow-up from the provider. This closes the loop on a really great model of patient care. The RPM vendor and the doctor's office really have to function as a unified unit. They cannot be in silos. They have to communicate. They have to work well together regarding the plan of care for a patient and the compliance that's happening. If a patient is non-compliant and they're having a hard time, this is where they communicate and they discuss this so that they can be on the same page to encourage behavior change. Also, there should be a consideration of rewards for compliance and behavior change. Some patients respond well to a text message from the provider's office. Some may want a video chat. What about a health tip? So when we have patients in an RPM program, there's other things that we need to do to continue to keep them thriving and to keep them moving towards an achievable goal. So let's set those goals and really make this program a holistic program. What are the benefits to the patient? There's so many. Again, when a patient is connected to a remote patient monitoring program, there's the assurance that someone is watching out for their health and well-being on a daily basis. This is a great feeling, and best practices, we're seeing that, and patient feedback, we're hearing that. This establishes trust with the provider and improves the quality of care for the patient. They're seeing all different things on the patient. They're getting a snapshot of behaviors, and they're getting their activity. They're just seeing more data to make a better informed decision of care. This increases active participation of a patient over their own healthcare outcomes. New behavior every day. They're an active participant in changing their outcome. RPM keeps patients healthy. It's prevention as well. Also, it encourages autonomy with our aging population. This is critical. We want to keep them living at home as long as possible, and they want to be autonomous. They want to be able to do this, so this helps support them to do that. Also, we need to look at the bigger picture is RPM benefits will also help reduce the number of hospitalizations, readmissions, and length of stays. A length of stay can be shortened for a patient when they're in the hospital because on discharge, they're given a prescription to be remotely monitored at home. And this allows the patient to recover better and in the restful environment of their own home while being cared for and being watched over. So lots of benefits to this. So to summarize, I think we can really understand that when we are looking at optimal patient engagement, the foundation comes from the messaging of the office, that relationship with the provider to the patient, the value of the program and what it's going to bring to them, and really set and identify goals, and really looking at that whole loop of the program and the value. And when we look at this, remote patient monitoring offers the best proactive method in creating a systemic and streamlined process to support patients and combat disease. We think about that, we understand that all these new systems can be put in place to alter the health outcomes of somebody and to keep more active engagement in what's happening with their health and well-being. Whoops, let's go this way. And that is a synopsis and just a breakdown of how to optimize your patient engagement. We are now ready to take any questions.
So thank you, everyone, and thank you, Monica. Thank you to those of you that submitted questions. We did have a few come in, and we'll get to as many as we can. Feel free, it's still open to submit any questions you have. So the first question we had, Monica, was how does the RPM company have a successful program with high patient engagement?
Thank you for that question. So what works very well, and I will refer to what we do currently at HealthSnap. As I mentioned in the beginning, we have the Angel team. So the Angel team is responsible for supporting a patient as well once they're in the RPM program. So as I mentioned, there's a unified collaboration with the doctor's office and the Angel team. And the responsibilities of the Angel team are to, number one, get the patient onboarded and set up transmitting data, but serve as that liaison to for outreach and for them to reach out to. And in the event that a patient falls off and is not transmitting a blood pressure daily, or is not transmitting a glucose reading daily, then that outreach angel will contact the patient and try to get them back on track. And this is no surprise to them because the angel is introduced to the patient at onboarding, so they are aware that this is another person that's going to be watching over their health. And what we're finding is this definitely increases compliance and engagement in an RPM program when you have this added value incorporated into it.
Thank you, Monica. So the next one we had come in is, what is the nature of the ongoing communications once the patient's enrolled in the program?
So a lot of times we are dealing with a variety of patients, different populations. And when patients are onboarded, we actually ask them, what method would you prefer to be contacted? What manner? Do you want a text message? Would you like an email? Would you like a phone call? Because we really want to communicate with the patient in a manner that they'd like to receive a communication from us. So we leave it up to the individual patient. A lot of people seem to enjoy text messages the most. Some do like that personal touch of a phone call, just because they're lonely and they want to have a little bit of chat and they want someone to support them. So all methods and all modes are on the table.
Great. So another question that we actually just had come in, and thank you, was who covers the cost for RPM and what is the eligibility criteria?
Thank you. So currently RPM programs, most insurance carriers are covering that copay. We're seeing that with Medicare. There's at no cost to the patient. Again, there is variability off of carriers. So some carriers do have a copay on the patient's end. So there is variability there. What was the second point, Sunny?
And the second part of the question was, what is the eligibility criteria?
Oh, thank you. Great, that's a great question. So once a patient gets connected to the platform and is onboarded, there's a requirement of 16 days of data transmitted in a 30-day period. So again, when we're looking at daily readings, blood pressure, especially blood pressure and glucose, this is highly achievable. But if not, then this is the role of the angels to continue to support them to get those data transmissions in.
Great, thank you. So the next one we had come, looks like we have time for one more, is how do you manage a patient that's stopped engaging after a couple of months?
Non-compliance, that seems to be the big question. So the goal is to never have them go away for a few months. So there's a hybrid approach of that happens to keep a patient engaged, from text messages to notifications to daily readings. In the event that a patient just falls off, our first and foremost thing is always checking to make sure a patient is okay and something hasn't happened. We have had situations at HealthSnap with a patient where a patient has been hospitalized. So when a patient does fall off for an extended period of time, what we do is we work with that office and communicate back to the office to reach out to the patient and make sure they're okay, and then help support them to get engaged back into the platform and into the RPM program. So again, a lot of it's done up front to be proactive so we never get to that place, but if we do, then we work in a partnership with the doctor's office to get the patient re-engaged.
Great, thank you. We are coming up on time. It looks like we did have some questions around equipment. If you could quickly touch on that, how patients receive equipment for the remote patient monitoring program, Monica?
Absolutely. So currently with HealthSnap, with some of our clients, we have a program in place that the patients are sent the device prior to their onboarding appointment. So in the flow of it, the doctor will prescribe, and once that prescription happens, then a patient is sent the equipment. So at the onboarding appointment, they do have that device ready to go for transmission.
Great, thank you so much. So thank you everyone for your questions. We did promise a 30-minute webinar, so we really appreciate the questions, and anyone whose questions we didn't get to, we will be reaching out to you personally to answer them. So we thank you all so much for joining us today, and we hope you're able to